Hello and welcome to my channel. I am so glad you're here because today we are going to do very simple and easy to follow exercises to relieve back pain. My name is Beth and I'm an evidence-based back pain specialist and clinical Pilates instructor here in Dallas, Texas. Couple things to remember before we start. First, make sure that you're working within your pain tolerance. Listen to your body, and if something doesn't feel good, you can stop at any time. You can pause this video, you can save it, and you can come back to it again. And if you have any questions, please do let me know in the comments, because I do these sessions for you. So your feedback matters and I'm here to help you. So please do reach out to me, okay? Now, you don't need any special equipment for today's session except a soft surface to lay on. You can just lay down on your carpet, but if you have your yoga mat, please roll out your yoga mat now, because we are about to begin our 12-minute session today. And today we are going to start in a seated position, okay? Subscribe now and let's start. Okay, excuse me. So separate your feet hip distance apart, or it can be a little bit wider as well. And we're gonna hold on under our knees or thighs. Now, the reason we do that is because it supports us, okay? But let's start first. Take a breath in. And then as you exhale, create kind of like a C curve with your back and roll halfway back. You see? So this is what I meant when your hand is supporting you, okay? And now you're gonna come back up and then you're gonna look up. So you probably feel a little bit more confident with your hands, especially if you are dealing with so much pain. Okay, now if you've been here and you did a couple of my sessions, you know you have the option to have your arms out in front of you. This is a less help and your core is working a little bit more, okay, and your abs. And we are strengthening our back muscles a little bit more. But again, if you're not comfortable or confident to let your thighs or knees go, please hold on to it, okay? We don't want to miss any steps when it comes to healing. And 3, and 2, and 1. Beautiful. Now we're gonna make it a little bit more challenging if you're up for it. Okay, we're gonna roll halfway back. And when we come up, we are going to lift the arms up and we're gonna look up and we're gonna end up in kind of like a little bit of an extension, but more like a flat spine. And then roll back. Now, if you need help, okay, I'll show you. So you're gonna do this. You're gonna come back and then lift the arms up, okay? You are more than welcome to have your hands to support you, okay? But this is the other version. You roll back and then you lift up. And then you roll back and then you lift up. Now, it's really important for you to feel safe, okay? We would like to signal safety for our nervous system, okay? And if you don't feel safe, please hold on to your knees and then you can lift up. Okay, let's do one more. Nice. Okay, so now this was flexion and a little bit of extension of our spine. Now we're gonna rotate it, okay, because the spine can rotate as well. Now what you're gonna do is lift up, so your chest is lifting up, and now we are going to reach the right elbow behind us and we're gonna look behind us and we're gonna bring it back, and then the left elbow. Very good. You can actually keep your arms up as well, but again, if you need to have your arm down, you can. And I actually do feel a little bit better if I have my other arm down. In fact, I can go a little bit deeper. I can even push myself into a deeper stretch here. Now, most of our rotation comes from our mid-back, from the thoracic spine. Okay, we're gonna do one more to the right and then one more to the left. Beautiful. Keep your hands on your knees. You can go a little bit wider with your feet. Inhale, drop your chin. We're gonna slide our hands further away from us. We're gonna take a breath in. And then we are going to sit all the way back up and then we're gonna look up. And then again, drop your chin and then slide your hands away from you. Be beautiful. And then up, 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 and you are doing fantastic, okay? I know you are, because you already showed up here despite the fact that you are dealing with back pain, so hats off for you. Okay, I know how does it feel when you are dealing with back pain. It can be very isolating, very depressing. You don't know what's going on. You don't know if it's safe to move or not. And you just don't feel safe in your body anymore, right? So this is why I'm here for you, to show up every single weekday, to give you a little bit of a spine movement for back health and spine health. One more. Because any movement is better than no movement, right? Okay, so from here, we are going to be on our forearms. Now, bring your right ankle in front of your left knee and left thigh. Keep this shape. Now we're gonna go to one side, and then we're gonna go to the other side. Now, only lower this shape down as far as it feels good for your body, okay? Everyone's range is different, and I just cracked my back and it felt so good. So everyone's body is different, okay? If you can touch the floor with your knee, that's great. If you can't, don't worry about it, okay? You are progressing, you are moving, and you are doing something for your health. And that's more important than any form. Okay, we're gonna do one more. Beautiful. I'm gonna scoot down a little bit more. And now the left ankle comes in front of your right knee. Very good. And one side and then the other side. Keep moving side to side. This is also really good for hip mobility. We cannot really separate the low back from the pelvis. So we are actually moving the whole body, right? One more, and we don't even want to, right? It's about the whole body's health. Good, now we're gonna lay down on our back. And then we naturally have a little curve in our low back, which we call lordosis, right? And we don't wanna change that. Some people have bigger curves, some people have flatter low back, and that's absolutely fine. We are all unique. Now what we're gonna do here is we are going to tilt our pelvis, and we're gonna jam our low back down against the floor and then away from the floor, and then just keep moving back and forth. You see? So I'm tilting my pelvis, and now there is no space behind my low back. And then when I move my pelvis back, I have a little space under my low back, and I can actually fit my hand under it. And that's my neutral, right? Good. Now on the next one is stay here. And now we are going to slowly roll all the way up with the waistband to the ceiling. Good. And now we are going to roll down. Very good. And then again, tilt the pelvis. Roll all the way up. Beautiful. Hold it here. And then roll all the way back down. And then again, tilt the pelvis. And then go all the way up. Beautiful. Now we're going to stay up. And now we only lower halfway down. And then we're going to lift back up again. And then lower halfway down. And then lift back up. Very good. Nice and slow. Now, if going all the way up hurts your low back, or you don't feel good about it, and it is more than tolerable pain, you don't have to push all the way up. So I show you, you can just go halfway, or you can just even hover. Some of my clients in the first couple of sessions, they can only hover, but trust me, after a couple of weeks, you can lift up higher because you get good at what you practice, right? It's the law of specificity. If you practice this movement, you'll be better at it. If you don't, then unfortunately, you probably won't get better at it because you don't have a chance to get better at it, right? It's like driving as well. Okay, if you don't use it, you lose it. Two more. And then one more. Beautiful. Now this exercise, just letting you know, it works on your back extensors as well and your hamstrings. Unfortunately, your glutes are not firing. Many people call this movement a glute bridge, but if you know anatomy, you do know that you are shortening your hamstrings, right? As you can probably feel it, sometimes some of my clients have even cramps in their hamstrings. But you don't, even if you squeeze your glutes, you're not really using your glutes, right? You're using your back extensors and your hamstrings, okay? Just wanted to clear this up. Okay, lower everything down. Now, arms go overhead. Very good, and I would like you to arch your back, and you can pop your rib cage up to the ceiling and arch your low back. And now we are going to jam our low back down against the floor, and then bring your right knee towards your chest. You have the option to lift your chest off the floor. If it doesn't feel good, stay down with the chest. Good. And now everything goes back, and then you have the option to extend the leg as well. Sometimes it puts, for some reason, for some people's back, a little bit more pressure in the low back. Again, if it feels better to keep your foot flat, please do so. Nice. And then we're gonna do one more with the right, and then one more with the left. And then bring the right knee very close to your chest and hold on to your thigh. Okay, you can actually use a towel or a belt to support this thigh if it's more comfortable. And then we're gonna kick up to the sky and then back down. Now, if you have sciatica pain, this is an amazing movement for you, okay? I love this one. I used to have sciatica in my left side, and whenever I did this exercise, and I'm not saying it fixed it, but it always helped me, right? Because when you have sciatica, it is about inflammation as well in your body, okay? It's not always a herniated disc. Okay, one more. And now we are going to switch. Okay, make sure that your low back is touching the mat, and then up, and then back down. Beautiful. So this is a great movement, and of course this is a great hamstring stretch as well. And then two more, and then one more. Beautiful. Now we are going to sit up, and we did flexion, extension, we even rotated the spine, and one thing we didn't do is side bending, and that's what we're gonna do today. Okay, you can sit with your legs crisscross. You can have your legs out in front of you. One hand goes down by your side. And now we are going to reach up and over our head. And we're gonna go straight to the other side. And then reach. Beautiful. And you can even rotate your chest down towards the floor to add a little bit of a rotation. If it doesn't feel good, you don't have to. You can actually even do this seated in a chair as well if you feel more comfortable, if your knee is not happy sitting like this, or your hip flexors. Okay, let's do one more here. And then the other. Beautiful. And now we're going to interlace our fingers above our head. And then we're going to look up, and we're going to take a big breath in through the nose. And then we're gonna exhale out, lower your arms down by your side. And this was our session today. If you like this video, if it helped you, please like it. Share it with someone who you know is struggling with back pain, okay? And comment it where you were watching from. I would love to hear from you, okay? And don't forget to subscribe to my channel to support me so I can make more videos for people with back pain. I go live every single weekday, Monday through Friday at 8:45 a.m. Central US time. So I hope you have a wonderful Monday, and I see you tomorrow morning at 8:45 a.m.